I think about it every time before I lay down on a table, all the time. I just pray before I go in that I come out, better.
I don't say I regret. I think if I knew more information, I would have acted differently.
Nunca lo hubiese hecho si alguien me hubiese dado un buen consejo o si alguien me hubiese a mí enseñado algo de lo que estaban pasando en ese momento. No lo hubiera hecho.
Yo sufro mucho con esto. Yo del VIH yo me siento bien. Y partes de mi cuerpo me lo han chequeado, estoy bien. Pero esto es lo que me está matando.
Police determined that the woman died shortly after being injected in the buttocks with silicone in her hotel room on Saturday.
In Morris's case, Miami Gardens police say he injected the victim's buttocks with cement, mineral oil, and Fix-A-Flat, then sealed the incision with super glue.
If we get something like silicone gel into those blood vessels, it can travel right to the lungs. Deaths have occurred as soon as 15 minutes after injections and as late as 2 days later.
Anytime anybody says, why would anyone want to do this? I say, it's not an issue of want to, it's an issue of you have to. You're either going to be dead on the inside or dead on the outside.
And one of the things that obviously they do, particularly male to female trans women, it's silicone injection. And they do that to sort of to blend in, if you will. We call it passing. So it's really to blend in within society. Who did it?
A doctor.
A doctor? Where?
Yeah. One in Tijuana and one out here. I don't think they were licensed doctors. Well, at least the lady who did my lower body. I don't think she was licensed.
Silicone is illegal. The type of injection that we see normally in the gluteal area or breast area, these are illegal in the United States. It's not FDA approved.
I think the motivation is like many, many other cosmetic procedures that people choose to do, which is to try and get their body to look like what they imagine they want their body to look like. And in the case of people who are transgender, there's a lot of negativity or dysphoria that they experience because their internal gender doesn't match their body. Part of their perception of how their body should look, particularly this is a phenomenon that we see in the trans women population, they perceive that their bodies need to be bigger in certain areas and smaller in other areas, so that would drive people to want to, I would imagine, to want to augment their body with silicone injections.
I feel like I'm young and that I should just enjoy life while I'm here now, and it's something that I want, and it's something that makes me feel better when I look at myself.
Apariencias se miraban sexys, yo miraba sus cuerpos y me llamaba la atención, porque yo también quería hacer un cambio en el que yo me mirara obviamente más femenina, sexy y más voluminosa.
So there's a lot of competition, there's a lot of comparison, and there's certainly a huge amount. It's almost an exaggerated version of what you would see in natal females, with the competition to look a certain way or appear a certain way that's considered desirable in the population.
Yo me empecé a inyectar porque yo miré que muchas personas estaban inyectándose el silicón y básicamente miraba los cuerpazos bien hechos y nadie miraba que se quejaba. Entonces yo decidí también por hacerlo, pero ya ahora que estoy viviendo mi propia experiencia digo no. Estoy arrepentida de haberlo hecho.
It's something that I really wanted. It's something that I feel that needed to be enhanced, and a lot of people that I know went to this doctor and I liked the outcome of it, so I felt that I could take the risk.
Although they may know of the potential consequences, they're still willing to go through this. They right away see the results, but they don't really think about the complications of the future.
I mean, if that's something that I can possibly die of doing, then I'm okay with that.
So oftentimes in our community, what happens is that there may be an individual who pumps, or that's the term that we use, pumps or injects other transgender women. ¿Quién te puso el silicón? ¿Fue un doctor o...?
No, fue en el mercado negro. Okay. Fue una persona que no tenía conocimiento en, digamos, en un proceso médico. Básicamente estaba arriesgando mi vida yo con esta persona, pero yo nunca tampoco me tomé el tiempo de investigar dónde podían hacerlo profesionalmente, que fuera legal, porque esto básicamente fue ilegal.
It's a small community and in some ways very tight-knit, that word of mouth gets around, so-and-so's doing this, so-and-so's doing this, and they're going this place to get it. And for example, a lot of times before young people seek hormone treatment under the care of a medical provider, they'll get hormones at a swap meet, or they'll get it somewhere else that's on the quote-unquote black market.
They go with the idea of that I can have a more beautiful, rounded gluteal area without having to do any surgery, or I can augment and enhance the shape of my breast without spending thousands of dollars by just simple injections.
Tuve más confianza porque yo ya había visto que ella estaba inyectando a más personas y nada pasaba.
When you're going to people for silicone injections, you're not necessarily getting medical silicone, you're not necessarily getting any silicone. So that's one of the biggest dangers of it. Is it's not sure, you're not entirely guaranteed to be getting what you're signing up for.
Y miraban que si, a ver qué era. Yo le decía que era el aceite mineral.
Cuando yo le pregunté cuáles podrían ser los posibles riesgos a futuro, ella me dijo que no había ningún riesgo, que no me preocupara.
I'm in the hospital and I am here with what they call cellulitis, which in reality is related to my silicone. And if you can see how swollen and dark it is.
Desde allí empecé yo a sentir la reacción de esto, que se me regó todo en las partes donde se me abrieron, se me fueron abriendo y todo eso, y ya fui con el doctor.
At times, very often, also because of decreasing in circulation, they have ulcers or worse yet, necrosis, which means dying of a certain part of the body.
The reality is that it's not going to be a thing that lasts over a long time, and it's going to probably get worse looking over time.
Lo único que ellos sugieren es que cuando está la infección ahí, podamos recurrir nosotros a la sala de emergencias para combatir la infección en ese momento. Con antibióticos.
Other than cutting big pieces of their flesh, which would probably result in more problem, nothing else can be done.
This is an issue that is not going anywhere, that is happening. And it's part of an individual getting competent health care.
I think definitively say there's absolutely no research in this area at all, and there really needs to be.
Education and prevention is probably the best treatment.
We also need to bring awareness to those, again, medical schools, policymakers, people who have the power to really make a difference in our community.
Of course, as we start with these younger kids, younger and younger, if we are able to transition people at the correct time, which is really as puberty is starting, if we can put them through the puberty that matches their identity, hopefully the idea of needing silicone injections is going to go by the wayside over time, because we'll be able to get the body development that's better matching their identity from a young age. As our treatment models get better and better and more common, and people are less afraid to treat transgender youth, I think we'll start seeing that patients are passing much earlier, they're going through puberty like they should have originally, and that body augmentation becomes kind of a thing of the past.
I just recommend that people don't do this, at all. And, take care of your body, because you have to. It's the only one you got.